Trumbull County, has no travel history. No travel history outside the state of Ohio. He has been hospitalized. Fortunately, he did not go to work when he developed these symptoms. He felt sick. As we have talked about and as yet medical experts have explained to us, these numbers are just going to continue to grow. And we know that these confirmed numbers are only a small fraction of the individuals who are infected already in the state of Ohio. Further, we believe that this is, in all likelihood, all throughout the state of Ohio. These numbers will grow. Dr. Acton will talk about this in a moment, in a few minutes. But we are told by medical experts that whatever the number is today, it will double in 6 days. And then that just continues on and on and on. Let me make a few announcements. The call center that you all visited, those of you in the press had the opportunity to visit, has now been moved. That was people were much too cramped in. It's not just a question of convenience. It is a question of their safety. People should not be working that close. And so they have now a big room, a large space. And again, I would emphasize that what we're looking as we go through this crisis, we're looking for people to be able to stay six feet apart. That is the safest way to be. So it's important we do that. We announced yesterday some new regulations, new orders in regard to our nursing homes. The reaction from the nursing homes has been that we need more restrictions. So we will be, within the next several days, issuing regulations that will stop visiting at our nursing homes. This is not something that we want to do, but no one knows the safety of their patients better than the nursing homes themselves. Again, what I would say to all Ohioans is this will not last forever. This is temporary. Everything we're doing is temporary. We will get back to normal in Ohio. It's not going to be done overnight, but we will. Let me also announce that Director Lloyd Chris is ordering in regard to our state psychiatric hospitals that there be no longer any visitation. No visitors. She will have a complete order later in regard to that. It will be similar to the checking that's going on in our nursing homes. People that have to be there, they will be checked for their temperature. These people coming in, it will be restricted as much as practical. Let me talk now about the large gatherings that are occurring in Ohio. In a moment, Dr. Acton will be signing an order banning the gathering together of people, over 100 people. So this is an attempt to make sure everyone understands that we cannot be gathered together. We cannot be in close proximity to each other. Let me read from the order. And then this order will, of course, be available for the news media. Mass gatherings are prohibited in the state of Ohio. The order reads, mass gatherings are defined as any event or convening that brings together 100 or more persons in a single room or single space at the same time, such as an auditorium, a stadium, an arena, large conference room, meeting hall, theater, or any other confined indoor or outdoor space. This would certainly also include parades, fairs, and festivals. For the purpose of clarity, a mass gathering does not include normal operations at airports, bus and train stations, medical facilities, libraries, shopping malls and centers, or other spaces where 100 or more persons may be in transit. It also does not include typical office environments, schools, restaurants, factories, or retail or grocery stores where large numbers of people are present. But it is unusual for them to be within arm's length of one another. A mass gathering also does not include athletic events that exclude spectators. Athletic and other events do not need to be canceled or postponed if spectators and other attendees are excluded. The order does not apply to or exclude immediate family members of participants in the athletic or other events, as well as anyone necessary for the event to take place. The order does not exclude the media, and there's more to it, but that is the basic essence of it. Well, in fact, let me read a couple more. The order does not apply to or exclude religious gatherings for the purpose of the expression of First Amendment protected speech, weddings, or funerals. Dr. Acton, if you will sign that. Two. Lawyers get through with everything, it gets a little more complicated here. 4 pages. There you go. Thank you very much. One thing I want to emphasize is that government can only do so much and only should do so much. We can make these orders about mass gatherings, but it really is incumbent upon all of us to protect all of us. It's incumbent upon us to protect our family members, our loved ones, but it's also incumbent upon us to protect total strangers. For example, order does not cover this, but we would hope common sense would. 25-year-old decides that since he was planning on going to the NCAA, can no longer do that in person. He obviously wants to watch it on TV. March Madness is not much better in sports. But he decides he's going to go to a bar, a sports bar. And when he gets in that sports bar, people are shoved in pretty tightly to one another. He leaves, has a good time. That night decides to go visit his 85-year-old grandmother. That's not a smart thing. What we all have to understand is while the 25-year-old, I knew how I felt when I was 25, and I was invincible. Most young people think they're invincible. And that's fine. He can make that choice for himself. But we know that the mortality rate goes up dramatically when we hit 40, 50, 60, 70, 80. Mortality rate, we don't know the exact numbers, but could be as high as 15% for an 80-year-old. So that is not a smart thing to do. And so these orders and all the things that we're talking about is putting separation between people, social distancing. Not sure I'd heard that term before the last few weeks, but I've learned it. So each one of us has that obligation. And you can't put out orders that cover every situation. But the key here is for people to not only protect themselves, but protect others. Let's say that 25-year-old has a girlfriend. And that girlfriend has a grandmother. And the grandmother has a friend. And we could go on and on and on. And that spreads, that's the way it spreads. And if every person, as we're told, who is infected will infect at least 2 other individuals, this thing just goes on. And if it turns over every 6 days, doubles every 6 days. You can see the importance of what we're trying to do, but even more important than what we're ordering, what's important is how people take care of themselves and take care of each other. We are in this together, whether we like it or not. I have seen Ohioans, and I've been along the Ohio River when we've had communities that have flooded. I've been to places where there have been tornadoes. I've been to Dayton when the mass shootings occurred. And I've seen every single time Ohioans come together. And I've seen every single time Ohioans take care of each other. And so that's what we all have to do. We have to take care of each other as we move forward. And look, we're going to get through this. But we got to go through this gauntlet. We got to run this gauntlet. And we got to try to get through that gauntlet without losing too many of us. And so everyone has to think about other people. That's why this is so very important. Let me move to another subject. I'm going to have Lieutenant Governor talk about this for a moment as the former Secretary of State, but voting is coming up next Tuesday. We want everyone to vote. I plan on voting tomorrow. My wife Fran tells me she voted at 1 o'clock today. She went in the Greene County Board of Elections, and there was 2 people there, only 2 people. So this is a great opportunity with early voting for people to have the opportunity to go vote. Pick a time of the day that might not be as many people. We're holding this election. It's right that we do so. It's important for our country to move forward. But there are opportunities in the state of Ohio for people to vote in many different ways. John?
Thanks, Governor. Earlier today, I spoke with Secretary of State Frank LaRose to talk through Election Day and the issues that he and the local boards of elections and the up to 30,000 poll workers in the state are preparing for. Let me just reiterate what the governor said. Early voting is an option for you. Take advantage of it if that is the best way for you to do it. Voting does not meet the definition of a mass gathering. Election Day will go on as planned. One thing that I know Secretary LaRose needs is that there are some poll workers who fit into the category of having unique health limitations, and so they will not be present as poll workers on Tuesday. And so they are attempting to secure more poll workers for Election Day. Poll workers are always an issue. You can do that at voteohio.gov/defenddemocracy, which is the Secretary of State's website. That you put in your name and your address, and they will connect you to the local board of elections to help secure you as a poll worker for Election Day. We urge people who are willing to do this, their what I consider patriotic and civic duty of coming together at a time of need. They can do that at voteohio.gov/defenddemocracy. Already, Secretary of State LaRose informed me that they've had 500 people sign up to help fill in for Election Day. I know that we are encouraging that among state employees who can assist in this. But I want to reiterate, Election Day is not considered a mass gathering. There are some poll workers who, because of unique health situations, will not be able to participate, and so we need poll workers. And please help your community, your elections officials, and the Secretary of State by signing up. Thank you.
Thanks, John, very much. We had a cabinet meeting this morning and talked about how we move forward. And the state needs to set an example. We are already seeing many businesses, almost by the hour I get an alert where a business has decided everyone should work from home. So I have instructed our members of our cabinet to make that assertion to determine among their employees who can work from home. Obviously, some state employees cannot work from home. We have prisons to run. We have other things to do. But if they can work from home, I've asked that the members of our cabinet start that process. I have a request from Jobs and Family Services to make a plea to the public not to come in person. Again, we're trying to cut down on contacts. So most of the contacts with Jobs and Family Services could be done over the phone. It couldn't be done online. Obviously, if it's an emergency and there's some reason it has to be done in person, they're open for business. But we're trying to cut down on contacts. Let me talk for a moment about price gouging. The Attorney General is prepared to enforce the law in the state of Ohio in regard to unconscionable sales. That's what it's called in the state of Ohio. That's what the statute was. And so I guess just as a statement, people are thinking about maybe making more than the usual profit. They need to kind of consider that. And we would ask people again to remember we're all in this together. We're all in the same boat. The faster we can get through it, the better. So I want to ask people to think about that as well. Let me now ask the Lieutenant Governor to come back. We're sending a letter to the President of the United States in regard to regulations. We are at a time when certain things that might be mandated as far as inspections by the federal government, regulations, it is not in the best interest of the people of Ohio to continue those. Inspections, for example, in a residential facility where the person who's doing the inspection might be going from place to place to place and then become a carrier. So John, you want to talk about that?
Sure. Thank you, Governor. This is consistent with the medical advice that we have been receiving from medical leaders like Dr. Acton to take the necessary precautions to limit any non-essential person-to-person contact. This will impact, when you're talking about state employees, the ability to timely inspect, regulate, and process compliance with both federal and state regulations, and as such we are preparing a letter to President Trump and Vice President Pence asking them for latitude in compliance and enforcement of federal regulations for state agencies and business. We have a number of agencies that regulate a regulate, inspect, offer licenses, and so forth, with a variety of businesses and government entities, and they need latitude consistent with the medical advice that we are receiving. Similarly, we are asking our state agencies to identify these same issues at the state level for businesses and local officials so that we can provide the same relief from the timeliness of state regulatory compliance. We are urgently working with the business leadership of Ohio and our state agencies to identify additional opportunities to provide relief and support for businesses that will be critically impacted by this pandemic. Just as we are trying to limit the health consequences of COVID-19, we are also seeking to address the economic impact that will result due to this pandemic. And so we are working to provide that support and that relief so that we can both take smart medical and health advice and also minimize the economic impact, because we know that the restrictions that come as a result of the COVID-19 pandemic, that there are going to be great stresses on business, and we want small businesses to know, and the people who work for them, that this is on our minds. We are working to identify in as quick a fashion as possible how the state and federal government, in coordination with local government, can help minimize the impact on them. Thanks, Governor.
Thank you, John. Just as we ask individuals to use their common sense, make rational decisions, as John said, it's also important for the state government to do that, local government to do that, and the federal government as well. We must treat this like what it is, and that is a crisis that we have not seen, most of us, in our lifetimes. Let me turn now to our schools. From what we can tell, based on what's happened in other states, based on what has happened in other countries, unless a child has a medical problem, the risk of death for that child is not very high. But children are carriers, and you can call them potential carriers. There's probably a more accurate way to say it, but just as an adult is a potential carrier, just as anyone in a school system or any place else in Ohio is a potential carrier, so are children. And schools are what they are. It's kind of the one thing we've all had in common. We've all gone to school, and we know what schools are like, and we know that people are come together a lot. And so there is a great concern. And we have today, again, consulted the best minds that we can consult. So we are announcing today that children of the state will have an extended spring break. The spring break will be of duration of 3 weeks, and we will review it at the end of that. This will begin this coming Monday, at close of school that day. Each school will determine access to the building after that. We would certainly anticipate in talking to educators that teachers would need access. We will continue to consult with educators about this, as we have been doing, and we've been very helped and informed by the educators that we have talked to. We have to take this action. We have to do everything that we can to have an interruption. We have to do everything that we can to slow down the spread of this virus. We know that it will continue to spread, but slowing it down will enable our healthcare providers, our hospitals, our doctors to be able to stay up with the medical problems that this virus is causing, as well as to stay up with people's normal heart problems and any other problems that they might have. We do not want to be in a situation where our medical providers are making life and death decisions of who lives and who dies. That is something that is simply unacceptable. And so this action is not an action that I took lightly, but is an action that we are confident is the right thing to do. We do close schools at other times. I'm not minimizing the impact this has on families, the change in plans, families who both parents work, We thought long and hard about that, and we understand the sacrifice this is going to entail. But this is the best medical advice we can get by people who study viruses, and we know it's the right thing to do. We have been working, as I know schools have, to make sure that some of the services, the non-academic services that kids get, such as food, that will be able to continue. Those are things that are important. We also know that educators have been planning and talking about this to see how they could have distance learning in some cases, and somehow handle keeping kids on a track as far as education. But we know it's disruptive. We know it's disruptive to the families. But we have to do this if we're going to slow this down. I'm going to turn now to Dr. Acton, who's going to talk a little bit more about the science behind all this. Doctor?
Good afternoon, everyone. This is certainly an unprecedented time. It is this 1 in 50 years pandemic that we've been planning for. We talk a lot about in my over 30 years in public health, but we've never seen a situation exactly like this. We talked yesterday about the steps we're taking and the playbooks we're following, but I really have to commend our governor, Mike DeWine, and our lieutenant governor. These are the hard decisions, and believe me, there's no one exact right, exact perfect. But the steps we're taking now will absolutely save lives. And I'll go over again why it's so important that it changes the impact on our healthcare system. First of all, we do have 5 positive cases. As the governor mentioned, our 5th case is a 55-year-old male near where I grew up, Trumbull County, and he is in the ICU. This is a man who has a family and kids who are also quarantined and many contacts. And our local health departments are busy at work letting folks know if they have been in contact with this gentleman. We have 30 negative tests, but as this moment when I came in, 52 people under investigation. And as I said before, those rings and rings are out there. I can't tell you the number of contacts. Right now it's in the hundreds that are also being told to self-quarantine. So this ripple effect I'm seeing spread throughout Ohio. It is in counties far and wide, and we do most definitely have community spread. Our lab, we are very fortunate to announce that we do have 2 more kits in addition to our 1 kit. That makes our capacity upwards of 1,200 to 1,500 people who can be tested, and our lab is going to 3 shifts now to help that testing process. We continue to man our phone line, so important for viewers at home, our 833-4-ASK-ODH. We continue to give you the latest information at coronavirus.ohio.gov. I know it is very, very hard for us to get our heads around this, and we're all sort of waking up to our new reality. And one of the things we're going to begin to put on our website, we began today, are a series of fact sheets and checklists to help you kind of figure out what is this new norm going to be like. So I really want people to stay tuned for that. You know, we are basically slowly shutting down most of our structures of society. We're asking people to stay at home in the hopes that they don't engage in this logarithmic spread of disease. As the governor said, that was such a key clue to this. It doubles every 6 days. And if you think about it, everyone who's not spreading it, me not spreading it to 2 to 3 other people, and those 2 to 3 other people going out, that is how we can slow this down. It's so crucial, the moves we're making in the next 2 to 3 days. In all our pandemic plans, we hope to do these measures I've talked about a little more slowly. But as we can see, we're in a crisis situation now. We're moving quickly. Taking decisive action now will greatly slow down this disease and stop this trajectory. So let me show you once again for folks who maybe haven't seen this. Again, our pandemic curve. We've talked about the fact that China was like this big yellow. My team has joked with me because I call it, would you like a big monster or a small monster? There's no scenario now where there is no monster. And again, our team has been planning for this pandemic curve all along. And every measure we're taking, even the president's new measures yesterday on travel, is meant to slow down the spread of disease, take longer for the entry because the entry will be amongst us. We know 40 and upwards % of our population will eventually get this. But when we are slowing it down and we're decreasing that spread dramatically, what we're doing is, this was my black line, this is keeping the numbers low enough so that we don't overwhelm our hospital systems. State of the art, as they are, there are only so many ventilators. There are only so many ECMO machines, and they must be used wisely by the sickest patients, and therefore, every action every one of us takes is going to save lives. And this is serious. You know, I'm trying to be serious. This isn't panicky, because what we can tell you to do about it is really common sense. But each one of us will need to use that guidance and make those decisions of how we can help. I think we need to begin to think about our households and not just ourselves as individuals. Dr. Fauci had said that if you have a sick or elderly person or someone with a pre-existing health condition like heart disease, lung disease, diabetes, obesity, a child who's on cancer drugs, you should act in your household as if you have this virus and take precautions similarly. Those are the kind of thoughts we need to do to make our decisions. I know this is hard because this virus is among us, but we can't see it yet. And therefore, we have to think of someone like a Tom Hanks. I can't think of a more normal and ordinary person to us, and that is us. We know now, just the fact of community spread says that at least 1%, at the very least 1% of our population is carrying this virus in Ohio today. We have 11.7 million people, so the math is over 100,000. So that just gives you a sense of how this virus spreads and is spreading quickly. The measures the governor is taking are very decisive and are really, really the measures you'll see fellow states making alongside of us. I want to speak to schools and businesses. This is a terribly hard decision. Schools are always the last thing you want to do. I am asking all philanthropies and all businesses to come alongside our schools and communities and our health departments to help in the days to come. This is going to take creativity on our part, but let me give you an example. Businesses need to be flexible to the extent they can with their non-essential workers. Say you are a parent who is at home. You can help make meals. We have wonderful backpack programs that are often when kids are on spring break, when winter break, during the summer. We have nonprofits that already do things to help these kids. Let's get them involved now. You can walk your dog. If you're out amongst nature, and we're going to need some, our cheap estimates at this time from modeling say that this might peak in late April to mid-May. But you can be outside when you have that control over your environment and that assured distance from other people. You know, that's different than a mass gathering or sitting in a seat out of doors next to someone. You can garden, you can cook. You see in Italy where people go about, they make choices like going to the grocery store once a week during non-peak hours. So these are the sorts of tips and guidance we'll give you, because I think we are all, myself included, going to need to understand how to live in something we've never done. And I know kids in schools out there are watching this right now. My husband is a school teacher. Hello, Bexley. I know you're watching this. And there are things that you can do too to help out. And this is the thing, like not dropping off a meal at an elderly neighbor's doorstep. Or I'm going to go so far as to say, your local health department right now has been working 24/7 weekends since mid-January. They're on the front lines of this investigation. I'm sure they won't mind a plate of cookies dropped off. But these are the little things we will do, not unlike a 9/11, and folks have said this will be the thing this generation remembers. And so it is these acts of unity and community that will be creative, that you all will be inventing, that will help us get through this. So we know we have a couple long months ahead, but we will keep you apprised step by step. I want to echo the Lieutenant Governor, young, healthy poll workers, another great way. I know college students are out right now. I know you care about voting. Not only do I want you to vote, but I want you to get out there to the polls and help out, because we have a lot of elderly citizens, retired, who do this work, who really need to stay at home. I need to say something to my fellow doctors and primary care folks, the nurses on the front line, the CVSs, the urgent cares. We need to think about this disease very carefully. There is limited testing. Every one of us needs to do a good clinical diagnosis. This is a virus, this is an infection, and there isn't time for a CME course on this, but think of the flu, think of the common cold, and act as such. You really need to do a good history with each patient. You need to ask about travel history. You need to ask if they've been in contact with someone under investigation known to have this disease. If you need help with this, a local health department can help guide that. But honestly, we're so busy right now, we really need, once again, even as providers, to use good sense. I have heard that there are urgent cares who are turning away sick patients. This is the time we need everyone to stay outpatient. We need them not in our emergency rooms. We need everyone to step up. There's great guidance on our site. You'll be getting more through the medical boards and otherwise. We really need all providers learning how to take proper respiratory precautions. They're now droplet with a mask. We need you to see people, and folks, if you're sick and it's mild and you're relatively healthy, you really can stay home, because we need the sickest people right now going to our emergency rooms. I'll give you more guidance on that in the days to come. Our health systems doing the testing, many of our major health systems have set up things, but they need a doctor's order, someone on the front line deciding who can ride this out and who really needs emergency testing. They will make the recommendation, and there are drive-through accommodations the hospitals will provide you for, because they're trying to keep the testing out of the emergency room. So you'll learn more about that, but this is a call out to all my colleagues in medicine to really go to the websites, look at the CDC guidance, and let's use our common sense. We're the front line, and we need to be MASH-like, and we really need to stand up and help people answer their basic questions. Rule out flu, rule out the other causes. Thank you, everyone. These are long days ahead. They are unusual times. It will be confusing at times. Doing this right, even 80% right, will decrease that blue curve, and it will make all the difference. It won't be perfect. It'll be frustrating because you'll have a little question that you can't get answered. But go to our website, coronavirus.ohio.gov, and we will all begin to do this together. Thank you so much.
Let me thank you, Amy, very much. Let me spell out the dates we're talking about in regard to the schools. We're talking about close of business close the school on Monday for the children. That will extend at least until April 3rd. So we're talking about 3 weeks approximately. We will review it as we go. We frankly have no idea at this point whether that will extend beyond that, but people can count on the next 3 weeks that kids will not be in school. Happy to take any questions. No.
Does it include athletics and after-school events if they don't have spectators?
No. The intent was not to include that.
To be clear, no school Monday.
No. That's not correct. Close of school Monday is when it starts. Whenever school gets out, 3:30, 3:45, 3:15, whatever it is, that's it for the kids up to that school in regard to, it's been expressed to us that teachers need to be able to do planning, they need to be able to do some things, so that's up to every school beyond that. I'm sorry.
Does it include private K-12?
Yes,
Public K-12?
all schools.
Governor and Dr. Ecken, I'm sorry to address this before, so many children in Ohio rely on free meals. If you did address that, I apologize. Could you go over what might be in place for those students who rely on schools often for most of their meals?
Look, we're going to do the best we can. We felt that this day may come. We're now there. So we've tasked, the different departments in the state to work on that. But Dr. Acton, I know you've been on that as well, so.
Yeah, I know other states where they've had to do some schools, and we already have some schools that have closed in Ohio because they have people under investigation. There is a way to waive the USDA group setting requirement. We have a whole task force working on all that and giving guidance to our superintendents and others. But I also think as I've said, there's a role for the philanthropies that usually take place in off times like spring break. Some schools might be closing Friday because they're on spring break next week, and those philanthropies are really well poised to help out in a situation like this. We've also heard talk of things like curbside pickup for people that can do that. But this is that Depression era, let's be thoughtful and creative, and each community is a little different. So you will see this play out. But what I can tell you is that our folks, our cabinet directors and others, and all the professional organizations will be giving lots of guidance to help folks how to make the best decisions. And we will be learning from each other about what works in each community. It is, again, I can't say enough, these are the hard decisions that leaders might make. There aren't great choices when you come to something like this. When you slow down, a society like we are doing, it has tremendous implications. But we know the implications if we don't. So we must make those moves now and for the greatest good.
And let me just say that, as far as what we do as a state, we will certainly ask for waivers from the federal government, but you're going to see us take the attitude that, we're going to do what we have to do and ask for forgiveness later. So we're not sure. I mean, look, you may have many as far as the food itself, how the food, this comes through a federal program, most of it, and so there are guidelines. The point is, how do we take that food and actually put it in containers so you're going to be able to hand it out for kids who are going to be able to take it home. We don't want to bring everybody in and feed them. That kind of defeats the purpose. So the idea is, we're going to have to work our way through that, and we're going to try to be helpful to the schools as they work through that. And Amy, go ahead.
I just want to say because I feel like the best good I can do is help those at home. Please know that lots of rules are going to be broken, and our country will be fixing it backwards. I've heard taxes will be delayed, all sorts of wonderful things that give us a little leeway, and that's what you're going to see happen. You're going to see regulations and rules be broken. So, and the USDA is about group settings. There's a very technical thing, but there'll be folks who can spell that out for you.
Government and the citizens of Ohio, we all have to have the attitude, this is a crisis, and we have to get the job done. and we're going to do what it takes to get the job done. Is it going to be messy? Yes, it's going to be messy. And look, it's not going to be perfect. We thought long and hard about making this decision. You weigh two things, and you weigh action or inaction, and you simply look, what is the greatest evil, what is the greatest damage? So we know that some things are not going to be the way they should be. We know that there'll be some kids who, will miss a meal, but we got to do everything we can so that doesn't happen, and we're committed to doing that. But not to take this action meant that we would wait. I mean, everybody, as we looked at this, everybody said, okay, well, we know we're going to close the school sometime. Okay, well, if we're going to close the school sometime, let's just close them at the appropriate time. Let's do it in as much early as we can. Let's do it. You can't say we're getting in front of this, because that's not true. It's here. You can't get in front of this. But what you can do is act at an opportune time. There's a sweet spot in there to act. We think this is it, based upon what all the evidence is and all the people that we have talked to.
The school closing, this is both public and private, correct?
It's every school in the state.
Every school in the state. And what are you saying to the restaurants, the large chains in our state who have more than 100 people that come to eat there? Those people are not allowed to have?
No, they're exempted out in the order. But again, we would ask everybody to think of their own welfare and think of everyone else's welfare. It's one thing to walk into a restaurant when you have plenty of space. That's a decision. It's something else if you're crowded in there. And so, again, what Dr. Acton continues to emphasize to me and the experts tell me is it's space. Keep space. Again, for someone who's spent a lifetime shaking hands and trying to talk with people, this is tough. But if I can learn to do it, everybody else can too. And so we need to back off and 6 feet and try to stay as much distance as we can from people.
For the parents who are hearing this for the first time, the school will close at the end of Monday. They're going to be scrambling for daycare, scrambling for babysitters and so forth. What's the message for parents out there who, boy, their lives are going to be turned upside down?
The message is we understand as much as we can. Everybody has a different circumstance. It's much more difficult for some than it is for others. But we have compassion for that. But we have a responsibility to save lives. And let me just finish. We have a responsibility to save lives. We have to take the action that is the best informed action based upon what the experts tell us to save lives. This is the time to do it. Now, we could have waited a week. We could have waited 2 weeks. We could have waited 3 weeks. That was not the time to do it. Now's the time to do it.
Are casinos covered in your order?
I'm sorry.
Are casinos covered?
We're looking at that. Not in this order.
Currently, though?
I'm sorry?
Casinos are not currently
No,
covered?
they would come under the same reading of that. There's no exception in here that I'm aware of for casinos, so the language would be the same. Okay?
For Dr. Acton,
Dr.
can you shed some light on the status of private labs and their ability to test? Do you know how many tests they can get out, what their capacity is at the labs, et cetera?
I would ask you to ask the private labs that, and I would definitely call LabCorp and Quest. Our team, our labs have been talking to folks there, but we really don't have, I don't have answers on that, but that's where I would look for those answers. We've heard they're up and running. I believe we've received one result. This is a Class A reportable disease. Labs out there, doctors out there, you must get on the call the second you see a positive. There are rules about this. Please check them, and you need to let us know because the state should receive all lab results, public or private.
Can you tell us about the 55-year-old? How long had this person been sick? What can you tell us about I don't know if you get into in terms of the number of contacts this person has had in the community, if this was a nurse or somebody.
This was not a healthcare worker. I believe the person had been ill a little bit over a week. And that is as much as I know. I do know the individuals in an ICU unit, and I do believe had some pre-existing health issues. But the local health department is doing that contact tracing now. I do know that there's a spouse and 3 children also in quarantine, and I believe possibly sick, but the test results aren't back yet.
I just want to add one thing about the issue, the question about children. If you look at the employers of this state, many of them are already taking action to allow, in the cases that they can, for their employees to work from home. This is, as Dr. Acton and the governor have said, this is an unprecedented time. And in unprecedented times, we have a patriotic and civic duty to pull together. Employers will have to understand the demands on their workforce as it relates to families. The federal government and the state governments will need to understand that and work to come up with support mechanisms to mitigate those the unfortunate circumstances that are happening with the employers and the families and in the schools. But the long-term view, the risk mitigation piece of this is that employers understand that language well. Having a sick employee in your workplace that spreads to other employees in your workplace is not good either. And so when you get out in front of this, as Dr. Acton said, and as best we can, because the governor said it's already here, to minimize that impact of which schools and school children can increase the spread, we are taking steps that are going to minimize the long-term health and economic impact on everybody. And that's why these decisions are being made.
Jim Giamatti.
Who's going to enforce either one of these orders? Who's going to be out there looking at the size of groups?
The rest of the people of the state of Ohio. Look, I mean, we can't put a police officer, every place in the state of Ohio. We expect that people will abide by this. We expect people to be civic-minded enough, patriotic enough to follow these orders. These orders would not have been issued if this was an ordinary time. As I said the other day, this is no ordinary time. This is a time of great stress and crisis, but it's also a time when Ohioans can come together, and Ohioans always do that. And I fully expect Ohioans to do this, and we will get through it. There is going to be light at the end, but it's going to get darker first. It's going to get worse. But if we do what we need to do now, we will get through this, and we will be able to have our hospitals that will be able to function correctly, and our medical folks, but only by taking this, what clearly is very dramatic and very drastic action.
I was wondering if Dr. Acton, could you kind of provide some more details on where Ohio is with testing? You said that you received 2 more kits, so how does that increase the capacity? Are you still waiting for reagent, like supplies, to be able to put this test into action?
So 3 kits equaled more sets of reagent, basically, and 1 kit, our estimates, because of the way it's complicated, but remember, before we had 2 specimens now, and we're really asking to our hospitals out there, hospitals are doing, once they have an order for a sick patient, drive up curbside testing so that they don't have to have someone come in the emergency room. To those folks out there, this is the quickest way I can tell you this, don't put it in 2 separate vials. We all love this long, if you've been tested for flu, you know what I'm talking about, the very long nasal swab that it doesn't feel very good. Don't do 2 of those, or if you do 2 of them, put them in 1 vial, because at the lab, we cannot separate. We cannot put them into 1 due to, it's complicated. So what I need is 1 specimen per person, a very good specimen. Those of you taking them know what I'm talking about. And send that to our lab right away. We are moving up to 3 shifts. What it means, Laura, is that it gives us a capacity approximately 500 people per kit. So now we have 3 kits, that's 1,500. And again, we're in the queue. The second, it's nothing we can do. We're just like, bring us more.
How long is the queue? where's Ohio in that queue?
I believe I shared these numbers. Right now, there are 52 pending, and there were 30 negative, 5 positive. So as you can imagine, the specimens are coming every hour, and you'll just see that number grow exponentially.
Follow up to the enforcement question. If there is a complaint made about a violation, are there penalties involved for a business that does do a violation?
I would definitely defer to the minute language of our order, but I will say this. There are not police going around doing something. A colleague, I worked in philanthropy prior to this job, and someone that I worked with said, we've got the homeless kitchen. What are we going to do? Well, they're looking at things like not sit around and eat, but packaging it. But I'm not no one from my department, they're all out investigating. They're not coming to that food kitchen to make you stop doing that. We have to use common sense, best judgment. There certainly are situations where we do enforce quarantine, and if we are in a situation like that, we would of course be coming to you and telling you that.
Doctor, are daycares in the same group as the school closings as well? Do you want to answer that, Governor?
Let me take that last question. I just asked legal counsel Matt Donahue. Matt, you want to come back up here again? These orders certainly can be enforced. They can be enforced by the police. We do not anticipate that's going to have to happen. But if we're seeing rampant violations, we certainly will have to take the action that we need to take.
That's correct.
You want to add anything to that?
No, I think that's a good summary.
Okay, good.
And to the mass gatherings, have you put a time frame on it?
No. Look, we don't know how long this is going to take. We've got to get through this. We did put a limit initially in regard to the schools. We wanted to give people kind of a bite and say this is going to be at least this long, but we're being very candid. It may be a lot longer.
Are the daycares part of the school closings as well?
I'm sorry, the what?
Daycares?
No, they're not
Many
included.
schools don't go on spring break until mid-April. So how is that going to be handled if they're not?
It's going to be up to the school. The dates, the school will make those decisions. What we're saying is we'll have no children in school from Monday at 3:30, close of school, and through April 3rd, which actually takes it into that's a Friday. So.
How does this affect state testing, and is there any learning to be done during this extended spring break?
Yeah, we would certainly, again, this is going to be left up to each school, how they handle this as far as learning. Some schools are better equipped for distance learning than other schools are. So that is going to be up to every school. As I indicated yesterday in regard to testing, we're going to have to see where we are, but we're going to make those decisions in consultation with teachers and with school officials. We don't know how long this is going to last. What we are going to do is not let testing get in the way of life at this point. I mean, if we don't have to, look, if we don't have to have testing, if we can't have testing this year, we can't have testing this year. The world will not come to an end if we don't have testing. So, we can do that. We're going to do what we have to do. We are in a crisis, and we have to treat it like that. So I know there's a million questions out there that people who are watching this on TV are asking, but what I would just say to them is we're going to try to use common sense about this. We're all in this together. No one's going to impose some crazy regulation that makes no sense. We're going to figure out a way out of it, and sometimes, frankly, we're just going to waive it and then turn to the lawyers and tell them, you figure out how we did it, but we're going to do it. So this is a crisis. I mean, you just think about it as a huge crisis. People should not be expected to follow every single rule and regulation. Now, we want people to try to do that, but if there's some that just flagrantly don't make sense, they don't make sense.
Has any thought been given to preparing or getting some kind of food for the kids that get fed in schools
and actually putting that food on the school buses and having those school buses go out daily on their routes?
Yeah, so look, I'm sure that sounds like a great idea. That certainly sounds like a great idea. We are a local government state, over 600 school districts. So we can set guidance, but ultimately the delivery of these services and the details has to be worked out at the local level. It's better to be worked out at the local level. And, you know, while we have made a decision that the schools need to close for the public safety of the people, the implementation of this certainly resides at the local level with the superintendents and school boards and the school officials.
Could you tell us what sentinel surveillance, that's yielded so far, what it's told us in Ohio? Do you have any update on that?
I don't have an update for people. The question was about sentinel surveillance, and I know our EPI team, which quite honestly I've been mostly next to the governor working on advising on policy, so I'll try to get some information on that and get it back to you as soon as possible from our EPIs who are quite honestly working 24/7.
Quick follow-up, for people who don't have a regular doctor or don't have...
Absolutely.
Like, who should they call if they're exhibiting signs?
Our FQHCs are really wanting to step up, our federally qualified health centers. We definitely have folks that can talk to their health departments for guidance on that. There are obviously the Minute clinics. A lot of folks are waiving copays. Look, we have to help out. If you are a medically trained person, take to heart that question. How are we going to help folks that don't have a regular provider? You know, we need to go back to our MASH selves and do what we need to do to help these folks, because there are folks, as you know, my work has mostly been with vulnerable populations. You know, I have said that, you know, those of you who know my history, schools were what saved my life. You know, I had times homeless, and school is the one place you can go. So when we are making these decisions, we are doing it absolutely thinking about what it feels like to that kid, and that's why these decisions are absolutely so hard. And that's why I need everyone out there to do their part to help and be creative. So this is that time that you can really make a difference.
You said this could peak in late April or mid-May. Can you give us an idea of what you expect that to look like?
You know, this is an evolving situation, and the science is ever evolving as in hourly. There are great minds at work in some of our best universities, at Hopkins, at Chapel Hill, at Harvard. You know, I'm in consultation with some folks. I'm talking to the gentleman who made the plans on non-pharmaceutical interventions. Fortunately, happened to know him. And, you know, some of the early modeling is suggesting that potentially there could be a late April, mid-May peak to this. But again, we don't have all the data. You know, our delay in being able to test has delayed our understanding the spread of this, and so we have to make these modeling decisions. It is going to be slow. Some early information I've received, we've heard about, will it go away with the summer? You know, coronavirus family is like the common cold. We still get colds in the summer. And while we might see a dip because people are more outdoors and they're not as tightly together, there is some thought that it won't go away altogether. Typically with some of these viral pandemics, you see, you know, a lull and a peak again and a lull. So as you see, when we take away some of these measures, we have to be very thoughtful and careful. Logarithmic, you know, 6 days it doubles. What you do today versus waiting 5 days to do something, you're talking whole different numbers. And so it really is that kind of science, the best science we have, and then making the best informed decisions, and we're making some very solid decisions here.
We'll go here first.
Could you talk about hospital readiness?
Talk about what, I'm sorry?
Hospital readiness. I mean, how prepared are we? I know you talked about some of the ventilators and machines. Do we have them? I don't know. I mean,
Yeah, so, you know, hospitals prepare for this all the time. Obviously, they have, and even in my role at the Ohio Department of Health, we have a whole emergency preparedness team. We've had this since 9/11. It's funded by the federal government. There have been funding cuts that you've been hearing about, but that team has worked on pandemic plans with schools, businesses, hospitals, ongoing since it was first established. And hospitals, so they have an infection control coordinator, and they have an emergency preparedness about the equipment, the PPE, and all the devices that you're talking about. So they are always in play. And hospitals right now, go to, say, OSU Medical Center, and they will tell you, I mean, I've been reading, because I'm still involved with OSU a bit, I've been reading what they've been doing in their planning. They've been drilling for weeks on this. But also one thing that's very unique right now, and I can't say enough about it because I need to thank them for this. I mentioned it yesterday, the Hospital Association, the Children's Hospital Association have really convened the major medical hospitals as across systems, so that we have regional plans, but they really are realizing, just like universities realize, it really helps when we're all talking to each other and making decisions together. The hospitals are all doing that right now across Ohio. I'm very proud of that. And that'll be important as the days come. And they do have, you know, I'd say if I was to estimate at a list I'd seen recently, just with the normal flu season, which we know is very heavy, RSV season, which is a virus that young children get, the hospitals say the children's hospitals have had one of the heaviest seasons many can remember. So that equipment is about partially used right now. I'd say some of the numbers look like a half in usage, those rooms. They have things called negative air pressure rooms, or they're AIIR. They're a type of room that you can go in and that infection is not spread throughout the hospital ventilation systems. But we have plans that go all the way to MASH. You know, we've had times in the past where we've run out of bags to put IV drips in because of a production problem, and they remember, oh, we used to use glass for that. I mean, there are solutions. And very similarly, CMS is waiving requirements so hospitals can do things like set up triage tents and work outdoors of the hospital. So very creative solutions. They're being done all over the world, all over this country. And so you'll see some of that. But it's all very well thought out and planned. Remember, you can have your plan, but it's predictably unpredictable. So we knew what all the steps are, and with each stage of a pandemic, we're employing those, but it will be very creative and very unique as this unfolds to respond accordingly.
We have those other events that come with schools. I know the classes will be scheduled, what about their sporting schedule and other things that are already on the schedule now?
Well, to some extent, that's going to be up to the schools, but as far as the sporting events, we've already outlined how that occurs. So, again, I think anytime we look at a question or the schools look at a question and something that's not spelled out, it comes back to the basic principle. We want separation. We don't want a lot of people together. These are very, very important things. But we've kind of outlined how athletic events should be dealt with. But again, you have to look at the individual facts, the individual case. No.
I had one more question for Dr. Acton, just on the testing. You mentioned that, well, I guess, how has the delay in testing and the limited capacity across the country, how has that hampered our understanding of the spread, and how has it hampered informing actions that could have been taken earlier?
So, you know, the testing is important because it gives us good data on what is going on. I can tell you that even without the testing, you know, I've already, while this is, I know for most of us, dawning very slowly, and we're all, again, we all have to keep reminding ourselves this is a new day and something we're dealing with. You know, I feel like this has been a very slow train coming my way. And I'm almost relieved that it is here and we are all collectively realizing it, because it's so predictable, a pandemic. I've assumed community spread all along. You know, very soon we'll probably stop testing at these levels because we'll just assume 40, upward of 70% that it, you know, it's going to spread amongst us, and we'll assume it is here.
Thank you all very much.
Thank you.
Just wrapping up a news conference there with the governor, Governor Mike DeWine, and of course the Ohio Health Department there.